Agreed, Cahill. Minister, can I start this speech in relation to proposing this motion by commending the tireless work of ambulance paramedics and those on the front line, many of whom I've spoken to over the last number of weeks in preparation for this private member's motion, and indeed a very healthy discussion that we had at the Oireachtas Health Committee with the National Ambulance Service and the Dublin Fire Brigade last week. 80% of life-threatening incidents should be responded to by an ambulance within 19 minutes, as per your own standards, the HSE standards and HICWA standards. The reality is, Minister, that the average ambulance response times for life-threatening call-outs has lengthened by 50% since 2009, by an average of 9 minutes, going from nearly 18 minutes to 27 minutes and up to 33 minutes on average in the South East. Statewide response times for the echo life-threatening call-outs, which, as we know, are patients who are in cardiac or respiratory arrest within the 19-minute time frame, has decreased from 80% in December 2017 to 76% in December 2019 to 65% in December 2022 and as low as 59% in the west of Ireland in December 2022. The statewide response times for the Delta life-threatening calls, which are all remaining life-threatening calls, has dropped from 54% in December 27 to 49% in December 29 to 30% in December 2022, and horrifically as low as 19% in Dublin in December 2022. And indeed, the Dublin Fire Brigade were very clear that the reason for this is a lack of capacity on the one hand, and then more lengthy wait times and turnaround times at hospitals with ambulances, as we know, parked outside hospitals waiting to disembark patients that they can't do because the beds simply are not there. The National Ambulance Service has about 2,000 staff, Minister, and I've spoken to you previously on this because we proposed a motion on this last year and we recommended that you would do certain things in your government and you simply haven't done it. We need to increase massively, as we know, the capacity in the National Ambulance Service. The workforce plan that the National Ambulance Service has put in place says that they need to recruit 1,300 more paramedics by the end of 2024, and indeed that we have to double the capacity, which is an additional 4,000 staff by 2026. That's a huge increase that has to be met, and yet the training places are simply not keeping pace at all. In fact, what the National Ambulance Service have said is that, I quote, recruitment efforts are being surpassed by service demand. So we're not even standing still, never mind getting to increase the capacity which we need to do. So this is a critical area which, in my view, Minister, you're falling short on. We know that we need to double capacity over the next 5 years. It's been clearly set out in the capacity review. I don't see any of those targets realistically being met, and what we're seeing is when we come to the life-threatening call-outs right across the state, the average wait times are going up. I mentioned the wait time for life-threatening calls in the South East. The average time for last year was 33 minutes for the entire year. That's from when somebody makes a call to when an ambulance arrives, and this includes those who are in serious cardiac arrest. You'll also know, Minister, that the South East is the only region that doesn't have 24/7 emergency PPCI, and yet it has the highest wait times for life-threatening calls by the National Ambulance Service. That is absolutely unacceptable and needs to be dealt with as part of increasing capacity in the service generally. The National Ambulance Service told us as well, Minister, that the average offloads or hospital turnaround time in Dublin last year was 39 minutes, which was 16% of incidents having a turnaround time in excess of 60 minutes, and that this was a massive increase in previous years. So when you look at all of the metrics and all of the data, what we're seeing is people are waiting longer and the capacity simply isn't being put in. So what do you need to do, Minister? You need to publish a multi-annual capacity and workforce plan, and that needs to be matched with increased training places and a sense that we're actually going to achieve that plan, because the current plan, in my view, is not going to be achieved. You have to look at spatial and regional distribution. You have to look at the west, the northwest and the southeast, where wait times are particularly high. We know we need more beds in hospitals, which will obviously help if we can have more beds where ambulances don't have to be parked outside hospitals for the length of time that they are. That certainly will help as well. We need to rapidly advance specialist paramedic grades, and we need to expand primary and community services. And finally, Minister, we also need to ensure that there's proper supports there for those who are in the service, because the ambulance paramedics I speak to are overworked, doing huge amounts of overtime, very stressful job, as you know, very difficult situations where they have to respond to very difficult call-outs, and they deserve our support as well. So I have to say, Minister, an awful lot more needs to be done by you on this issue.
And just to say, Deputy, sorry, I omitted to say that the motion is re the National Ambulance Service.
Thank you, Cathaoirleach. Minister, first of all, I want to commend Deputy Cullinan for bringing this motion forward, and indeed I wanted to commend the staff in our National Ambulance Service for the huge work they do and the tireless work they do across the length and breadth of the country. In the North West, this has been an issue for many, many years, in fact for decades, where we have isolated rural areas where the wait times for ambulances are gone through the roof. We see what the averages are, but averages can sometimes disguise particularly long individual cases. We've had people who have waited an hour and a half for an ambulance in some instances. And I suppose to the core of this is the issue of dynamic deployment, which has been a disaster for people. And when we hear of dynamic deployment, we think it's NATO having manoeuvres in the South Pacific Ocean, but it's not. What it means is that an ambulance that's based in Carrick-on-Shannon is called to South Roscommon for a call. When it's in South Roscommon, then it's called into Galway for a call. When it's in Galway, then it's called over to Mayo for a call. And they're travelling from place to place around the country. And we have the same thing happening everywhere, where the local service has been depleted. And we see this in all the areas up and down the length and breadth of the nation. And yet, governments seem to be blind to it and continue with this process of continually putting pressure on our services, where ambulances are running up and down the country to calls which is way outside of their area. The reality for all of that is that there simply isn't enough of a service there. There aren't enough ambulances, there isn't a plan in place to have enough staff for the ambulances that are in place, and there are not enough ambulance stations in place as well, because many of them are very rural and isolated and they can't get to them in time. So, Minister, what our motion here is calling for is a multi-annual capacity and workforce plan to be put in place immediately. I think that needs to happen with urgency. And you know, the impact of this that it has on people out there, and I have been contacted by many people over the years who have waited serious lengths of time. I remember a woman who had an accident in Carrick-on-Shannon, a car hit her on the road, and she waited an hour and a half before an ambulance came, and yet there's supposed to be an ambulance station in that very town. And you know, the stress and the inconvenience for people that this all does, you know, it just destroys people's confidence in the possibility of having a health service that can deliver for people. The other aspect of that goes back to our hospital system, where if you go into Sligo University Hospital or any of the hospitals across the country, you will see queues of ambulances built up outside, waiting to take patients in, and they can't take them in because the emergency department inside is already clogged up. So, Minister, you really need to take this seriously and urgently.
Emergency health services in Dublin are at breaking point. Frontline paramedics and operational staff have kept the ambulance services running with their tireless work, but they have not been properly supported by this government. The ambulance service is not able to do its job to the level we need because it hasn't got the capacity. People are now waiting more than 20 minutes for an ambulance in Dublin and the East Coast. The average response time is now 22 minutes. But, Minister, I know of cases in my own constituency where people were waiting for an hour. Delays in hospitals are also causing ambulances to be delayed outside for anything from 40 minutes up to 1 hour in Dublin. The Government and the Minister have failed to support our frontline paramedics to keep up with the demand for emergency services. Now, the situation is now scandalous. All of the figures show that our health services are going in the wrong direction. The crisis is clear to see in our hospitals as well. The average wait time in emergency department in Beaumont Hospital in December was 17 hours long. Elderly people aged over 75 years were forced to wait more than 17.5 hours on average. This is more than 2.5 hours longer than 2019, with people spending time on trolleys, on chairs, in corridors and corners. The Government, Minister, must get its act together and implement Sinn Féin's plan to fix our emergency service and better support our paramedics, nurses and doctors. The Minister for Health should urgently publish a multi-annual capacity workforce plan to meet the needs of patients and improve the ability of the National Ambulance Service and Dublin Service and our hospitals. Thank you.
Thank you, Deputy. Deputy Claire Curran, 2.5.
And I too want to welcome this motion and the debate on such an important issue. And this is a really important issue, particularly in rural areas where people tend to live more remotely and they tend to live further away from our hospitals. And I, like I'm sure everybody in this House, have been contacted by constituents every now and again, frustrated and annoyed when it happens to them, where they contact an ambulance and they have waited and waited for that ambulance. It causes great distress and they call them when they are in need. Sometimes people aren't aware of the way in which ambulances are deployed, and just because your ambulance base might be only down the road, that's not to say the ambulance is there. And in our area in particular, the ambulance could be in Galway, it could be in Sligo, it could be in Mayo, and it could be well outside of the county. And this is particularly problematic where the local base only has a single crew. And that is one reason why the ask in this motion for an urgent review of the coverage of the ambulance fleet is so important, and this review is key, especially in areas where there are just one crew in place. So, for example, in my own county of Roscommon, the ambulance base in Lough Lynn in west of the county and Boyle in the north of the county are both single crews. This is putting huge pressure on both teams in both bases. And the area of Boyle and Carrick-on-Shannon is particularly under pressure. And when they are under pressure, then Lough Lynn and Boyle are under increasing pressure. And yet it appears, rather than looking at putting additional supports in there, that is not happening. There is a serious staffing crisis in the Midlands, and that is having a real knock-on effect in County Roscommon especially, and that is an issue that has been raised with me many times, and that is why the other ask in this motion in relation to a workforce plan is so important as well. Response times for life-threatening incidents in the West have worsened. They are now 26 minutes on average, and of course, as has been said by my colleague, you would often hear of people waiting much, much longer. I spoke to a paramedic earlier today. Their 12-hour shift last night was to finish at 7 p.m. He and his crew finished 5 hours later at midnight, and that is happening all of the time right across the board. There's a massive reliance on overtime. Shifts are running over. That is practically the norm now, and paramedics, of course, can only sustain that for so long, and they shouldn't have to. They're facing burnout. This is an issue of massive concern, and it needs to be dealt with, and I think this motion should be implemented urgently.
Thank you, Deputy. Deputy Circuit Clerk.
I want to add my voice of thanks and commendation to the tireless workers from the National Ambulance Service and our paramedics. It is very clear that lives are being put at risk because of government's failure to resource the National Ambulance Service and to support our paramedics. The HSE's own standards say that 80% of life-threatening incidents should be responded to by an ambulance within 19 minutes. However, at the moment in the Midlands, that response time has increased 53% to 29 minutes since 2019. Every ambulance region is further away from meeting targets since 2019, and this trend needs to be reversed. The outcomes must improve, and that needs a multi-annual capacity and workforce plan to meet the needs of patients and to improve the ability of the National Ambulance Service to do the job that we are asking them to do. The ambulance service is under serious strain and pressure, exactly what the paramedics themselves were saying was going to happen for years at this point. They have about 2,000 paramedics, and their own workforce plan lays out the need for more than 1,300 additional people by the end of next year, and a need to double the staffing composition to more than 4,000 by 2026. Now do the maths, Minister. If there are only 181 patient and clinical care staff started in 2022, and since 2019 the college has started training just 472 new recruits, less than 160 a year for a 3-year programme. We need to double the number of paramedics in training, and we need to engage with qualified paramedics who are no longer working in the ambulance service to try and bring them back, because paramedics are burning out. They are absolutely exhausted, and that's what makes retention critical to meeting these targets. But retention plans will fail unless there are more paramedics in general to share the burden. Now, I've read the amendments put down by government, and it talks of the established number of alternative care pathways. But, Minister, you failed to mention the record overcrowding and the growing waiting lists. You mentioned that parts of the country are not yet seeing improvements. So a question I have for you this evening, Minister, is which parts of the country are you willing to sacrifice?
Thank you. Deputy Ray de Crone.
Most of us hear of a story about how brilliant our ambulance paramedics and personnel are. They're the men and women that we hope never to meet, but when we do need them, we want to see them as quickly as possible. I know my own local Maynooth ambulance base at Maynooth very well, as I campaigned against it having its hours cut back during the austerity government of Fine Gael and Labour back in 2012. Ever since, Maynooth and the surrounding towns in North Kildare have no ambulance operation from its Maynooth base every Thursday from 7 a.m. until 7 p.m. If an ambulance is requested in our area during those hours on a Thursday, it will have to come from further afield, West Dublin, Tala, and we've even had them come as far as from Cavan. This has drastically increased response times, and as you're well aware, our response times are critical in cases of acute emergencies. As a result, as a result of the ambulance cuts, a few of us got together and we founded the Maynooth Community First Responders in my town a few years ago, and the local ambulance personnel in Maynooth were a great support to us, along with the NAS. And I really want to pay proper tribute to our ambulance personnel, both the frontline paramedics and the operational staff in Kildare North, for what they do, because they are certainly not valued by the Minister for Health and his government, and that's what they're saying to me. And you can see that failure in the way our ambulance personnel cannot respond in the way they really wish that they could. And, you know, as HICWA recommends, they should. The target is that 80% of life-threatening emergencies should be responded to in 19 minutes, and we're simply not meeting those. And as already outlined by our health spokesman, Jacques Cullinan, the government neglect of this essential service has seen that percentage it's falling through the floor. The NIS say it needs to double its staffing complement by 2026, and it also needs to increase paramedic personnel by more than 1,300 paramedics in that same period. And Minister, we know because we listened to them. And in the last budget, you didn't listen to them. They told you that they want a multi-year capacity and workforce plan, and this is what we're calling you to provide in this motion. They need this so they can plan for the future to meet the emergency health needs of citizens all across the state. And you have to start looking after the people who matter, Minister.
Thank you, Deputy Angus O'Snowden.
I want to first of all commend the professional and compassionate manner that those of the ambulance service, but in particular in Dublin, where I've had quite a number of interactions with them in the last few years in relation to family members, and that they're absolutely brilliant. And during COVID, the care and attention that they gave and the compassion and how they dealt with people is a testimony to in some ways, a gift that they have. And what they want to do is to save lives. It's pure and simple. But there was and there is a frustration, there is a stretch, and they're stressed themselves because they can see the solutions, but they're not getting the answers. And this government and the last government have failed them because it has been outlined quite clearly what the solutions are, the need to address the fact that ambulances are stuck at the hospitals at the A&E, in many cases, to turn around, but also the fact that there isn't enough. There is not enough recruitment. There is not enough vehicles. They can't get to problems that arise. So when an old woman falls in the street and can't get up, and neighbours think she has a heart attack or a stroke, and they're told, leave her, don't move her, and it's 40 or 50 minutes later, and this is in the city, where it would have been easier for me or some of the residents to put that woman on my back and walk as far as the hospital. I would have been there quicker, but you're told to leave her, and that's an old woman in the middle of winter, kind of on the cold road. The fire station is 300 yards away, but no ambulances because they're stuck in the hospital, or there isn't enough of them. There isn't enough crew, there isn't enough. We have the figures, how bad it's getting. We can't continue in that vein because our lives are being lost, and it's pure and simple. Lives are being lost because we don't have enough ambulance services, enough ambulance crews and enough ambulance themselves. So something has to change, and the change has to be that a proper investment and a proper recruitment drive.
Minister, the simple fact of the matter is, as you acknowledge, the ambulance service is under huge pressure, and nobody on this side of the chamber would ever criticise any of the workers. In fact, we've all been exceptionally supportive of them, and that's why they have engaged with us on this matter. You've seen it recently here in this building, when a person fell ill, I called the ambulance service at 11 o'clock in the morning, and then at 4 o'clock I got a call from the ambulance service, the Dublin Fire Brigade, to say that they had apologised, that did we still need the ambulance, did we still need that service? And they were apologising, and I had a conversation with him, and he said that they were stacked up by the dozen. That was in Dublin. We're not talking about a rural area here. There's a fire station just down the road from us here. You'd literally walk 5 minutes down to it. And that was the call that I got at 4 o'clock. This is just one of the many first-hand experiences that we have in relation to the ambulance service. My own mother was left waiting for hours, waiting on an ambulance, and she lives in East Wall, and the matter is only up the road from it. These are the experiences that we're talking about. And this is just my personal experiences. There are dozens of other experiences from people, both in this chamber and right throughout the state. We've had extensive conversations with Dublin Fire Brigade in relation to recruitment and retention of firefighters and paramedics, and if you speak to any firefighter who's a member of the ambulance service crews, they'll tell you quite clearly not alone there's not enough staff, but simply not enough ambulances. And recently, just today, I raised the issue in relation to the closure of the Emergency Children's Urgent Care Centre to appointments only, from walk-in to appointments. And one of the biggest issues that parents were talking about in Dublin West is the fact that it's going to put huge pressure on the ambulance service, because we're waiting on, they can't get appointments for GPs. Now they'll have to go online to make an appointment for an urgent care service in Connolly, in the Children's Hospital in Connolly. So that absolutely is going to put huge pressure on the ambulance service as well. So we're heaping more pressure on people and parents in particular. And I know, as someone who's used the Children's Hospital on many occasions, if your child is sick and ill, you're not going to go online, self-triage yourself, because that's what the system is. You go on a few different options and you self-triage. You're not going to do that. You're going to go call an ambulance and you're going to go straight to Temple Street.
Deputy Johnny Quirk, 2.5 minutes.
Thanks, Minister. Sinn Féin commends the tireless work of frontline paramedics and operational staff who keep the ambulance service running without proper support from government. In a National Ambulance Service Plan presentation, the ambulance service says that they have an urgent need to recruit additional staff, as recruitment efforts are being surpassed by service demand. Dublin Fire Brigade have said that demand for ambulances is continually identified as being far in excess of Dublin Fire Brigade capacity. The National Ambulance Service currently has 2,000 paramedics, and their workforce plan lays out the need to double the staffing composition to more than 4,000 by 2026. It also states that the ambulance service needs more than 1,300 more paramedics by the end of 2024. SIP2, not Sinn Féin, has said that the National Ambulance Service is at breaking point. Increasing numbers are attending accident and emergency departments across the country, which has severely impacted turnaround times, with crews having to wait hours on end to hand over their patients because of lack of beds. As was the case in Drogheda, when 13 ambulances were left treating patients in the back of their ambulance as no beds were free. My own county of Meath, where Navan is being bypassed, people are very worried and concerned that they will be waiting hours to be admitted in Drogheda or Connolly hospitals. Last month, paramedics in Navan said that most runs were going to Drogheda with little or none staying in Navan, and then after being seen by a consultant, they were then sent back to Navan. That seems outrageous and must be adding to their workload. We need extra hospital beds provided for our hospitals so that patients can be admitted in a timely manner, which will in turn improve quicker turnaround times. We need to more than double the number of paramedics in training and engage with qualified paramedics who are no longer working for the ambulance service to try and bring them back. Paramedics are burned out and exhausted, which makes retention critical to meeting these targets. Retention plans will fail unless there are more paramedics to share the burden. Thank you.
Deputy Morris Quinlivan.
Thanks very much, Cathaoirleach. Minister, too many aspects of our health service are failing. In my own city, the emergency department and UHL and mental health services, particularly those youth mental health services, are under huge pressure. According to the Irish Examiner today, 700 patients in Limerick, Nenagh and Ennis had operations cancelled in the last 6 weeks alone. Other challenges facing our hospitals in terms of capacity and staff retention are also facing our ambulance service. Everywhere we look, there are challenges, and every term, Minister, you have fallen far short in addressing those. Like far too many of our health professionals, our ambulance staff continue to do tremendous work with limited resources and with limited support from the government. The paramedics and the operations staff deserve tremendous credit for their performance, and the reality is there's just not enough of them. It seems whatever figure you look at, the trends are going in the wrong direction. Response times have increased by 50%, with the national average response time to call-outs at 27 minutes. The ambulance service avoids that they have an urgent need to recruit staff as demand for their services are increasing. The ambulance service has 2,000 people employed, and their workforce plan avoids the need to be doubled by 2026. Scotland, which has a similar population to ourselves, has 5,000 people employed in their service. Our ambulance service has been run into the ground over the last 10 years, and this is shown as average response times and patients' experiences have worsened. The unavoidable reality is that emergency call-outs are taking longer because the ambulance service is understaffed. I met the National Ambulance Service and unions representing their members with our health spokesperson, David Cullinan, and they explained to us how our paramedics are burnt out and totally exhausted. The ambulance service spent £18.8 million on overtime in 2021, with 2/3 of paramedics working significant overtimes every month. There is an urgent need to address training places for paramedics and invest in ambulance services to recruit and retain paramedics. Without an uptick in recruitment, we simply will not meet the 2026 target of doubling the current National Ambulance Service staffing levels. The problems at our hospitals are contributing to the issues in our ambulance service. The offload times at hospitals are being prolonged, and this has contributed to the capacity and staffing issues in our hospital workforce. The numbers of people being treated on trolleys in my local hospital, University Hospital Limerick, stands at 1,561 for the month of February, which is a truly shocking figure. An average of 82 people every single day on trolleys were recorded in February. The accident and emergency department at the University Hospital Limerick cannot cope with the influx of patients, with an average of 240 people presenting daily. So our cause is that the crisis in our health service is multifaceted, and this government shows no sign of being able to deliver. The staffing and response times in our ambulance services are putting patients at risk. Our trolley crisis is putting patients at risk.
Look, we have a health service that's in crisis, we have hospitals that are under pressure, and we have staff who are working in the ambulance service that are under severe pressure. We commend the work that they do, but they need to get the support. We need the capacity and the plan for government. I'm going to thank the Dundalk Democrat for dealing with this issue, and I quote, "As many as 163 ambulance dispatched to non-cardiac life-threatening emergencies in Louth in 2022 took longer than 1 hour to get to a patient. Shocking new figures have revealed. The figures are almost 4 times the number of calls which took longer than an hour to respond to in 2021. National Ambulance Service guidelines state that an ambulance should aim to arrive at the scene of an emergency non-cardiac incident within 19 minutes. However, 163 patients were forced to wait longer than an hour for an ambulance to arrive last year, according to information released to the Democrat under FOI. The longest wait time for a cardiac life-threatening incident in Louth in 2022 was 4 hours and 50 minutes, with volume of work given as the reason for the lengthy delay. Life-threatening calls are split into 2 categories. That's Delta Red, non-cardiac or respiratory arrest life-threatening calls, and Echo Purple, life-threatening calls relating to cardiac or respiratory arrests. In total, 111 Delta ambulance calls were logged as taking over 1 hour to arrive at their destination due to volume of work. 37 were delayed due to distance involved. Other was logged as the reason for delay in 8 calls, while 4 cases which took over an hour were logged as slow crew mobilisation, with 2 further delays logged as difficulty finding location and the remaining case logged as slow rate of response by crew. I'm just going to detail the overall figures. 62 people experienced a response time in excess of 60 minutes, less than 75. 40 experienced a response time in excess of 75 minutes and less than 90 minutes. 17 experienced a response time in excess of 90 minutes and less than 105 minutes. 13 experienced a response time in excess of 105 minutes and less than 2 hours. 31 experienced a response time in excess of 2 hours. Look, I think I will leave it at that. Minister, you've gone into some explanation in relation to the improvements that have been made. Well, there want to be a hell of a lot of improvements to ensure that we're not looking at figures that are the same or worse for next year.
Thank you, Minister. Sinn Féin, 10 minutes. Deputy Louise O'Reilly to reply.
Thank you, Cathaoirleach, and I want to start by acknowledging the really good and hard work done every day of the week by workers in the Dublin Fire Brigade and the National Ambulance Service. Despite this government, they are holding the service together with their hard work and their dedication. Even in a well-staffed service, even in a service where government provides leadership, unlike in this instance, those workers are under pressure. Their work environment is naturally a pressurised one, and it is made worse by the lack of leadership from the government. Short staffing, as you know, compounds the pressure that these men and women are under every single day of the week, and the tactic of attacking opposition politicians isn't going to work. And I know that the Senior Minister isn't here, but I did hear his contribution, and I'm going to tell you there's something more than a little bit pathetic about trying to point fingers at members of the opposition and trying to twist our words. But the workers in the Dublin Fire Brigade and the National Ambulance Service know damn well who is on their side. They know exactly the names and indeed the parties of those who cut their pay when their back was to the wall. They know exactly who imposed a recruitment moratorium from which they are still trying to recover. Minister, on Christmas Day, a relative of mine fell and she hurt herself. We didn't know at the time, but she'd broken her hip and her femur. At 7 o'clock, we called the ambulance. By 8:30, the ambulance had not arrived, and we spoke to fantastic people on the line. They stayed with us right the way through. They advised us not to move her, but it was freezing cold and it was raining, and we had to move her. The woman had a broken hip and a broken leg, and I drove her to hospital that night, and I was terrified. Now, I spoke to people on the phone, and my sister did as well. They did everything that they could, but the resources were not there. And I just want you to know, as a member of the family who was there, it was absolutely terrifying. Like, you don't realise how much you depend on the service until you pick up the phone. And the person on the other end of the line did everything that they could, but they could not dispatch an ambulance. That was the key, and it was terrifying, not just for me, but for all the other members of my family. And can I just say, in the final moments left to me, men and women working in the retained fire service in Skerries and Balbriggan did medical work during COVID and have been locked out of the COVID payment because they're members of the retained service. I would implore you, Minister, to please discuss this with the Senior Minister to try to see if good sense can prevail in this instance. Go on,
the Chief Fire Officer for Dublin Fire Brigade told the Oireachtas Health Committee last week that the combined resources of the National Ambulance Service and Dublin Fire Brigade cannot meet current ambulance demand in Dublin City and County. I sat through the meeting, so I know what he actually said, which seems at odds with what the Minister is saying. But you would think that that would be a wake-up call for the government, that there's something very wrong with the way they're resourcing our ambulance services. Dublin is a growing and expanding city, and we're simply not being able to keep up with demand. Ambulances were only able to respond to less than half of non-cardiac life-threatening situations within the target time of 19 minutes. So that's ambulance less than half of non-cardiac, life-threatening situations within the target time. Every minute is vital in these situations, and we're failing both ambulance and fire crews and the people who need them by putting them in impossible situations like that. The Health Committee also was told about the values of programmes like the Pathfinder, which aims to treat people, particularly the elderly, in their own homes as a means of keeping them out of hospital in the first instance. It was mentioned by a number of speakers. But I fear we're actually too slow in recognising the values of programmes like this and rolling them out right across the wider health service. And I think you'd probably agree with me, Minister. The training sector also needs to see a huge investment. Currently, we're simply not able to get enough newly trained paramedics into the system to cope with the demands and people who are leaving or returning. So currently, we're sending paramedics over to Britain for placement, and a lot of them just don't come back as they're snapped up by the NHS. So if we could train them, more of them at home, we might lessen the brain drain. The logjam in our emergency department plays a huge role in the problem also. If ambulances are stuck outside of hospitals, while the staff inside grapple with the overcrowding and the lack of beds, then we're not on the roads heading to where they're needed to actually save lives. So we need to see greater investment, training in new vehicles. We need to roll out programmes like Pathfinder. But what we need most from government is to take it seriously before it even gets worse, and where we heard in terms of harm and the loss of life. And that's where I think we're all agreed here tonight. We need to do more.
Deputy Cullinan.
Margaret. Look, it takes a bit of a brass neck to deliver the speech that Minister Donnelly delivered earlier this evening, because it's so full of inaccuracies and mistruths, it's hard to know where to start. But I'll start with the first one, where he said that the Sinn Féin motion would have you believe that our National Ambulance Service professionals are failing in their job. In fact, the very first line of our motion commends the tireless work of frontline paramedics and operational staff in dealing with increased demand without proportional resource increases. We had the National Ambulance Service and the Dublin Fire Brigade senior personnel tell us last week in the Oireachtas Health Committee that demand is outpacing supply in terms of ambulance capacity, and that people are waiting longer for ambulances in terms of emergency and non-emergency call-outs. And the second mistruth in the Minister's written statement, which he read into the record of the Dáil, was that response times are improving. And I don't know what planet the Minister is on, but let me give the response times again in the Minister's absence and let those ring loud in his ears, because he really needs to take his head out of the sand when it comes to the National Ambulance Service. So I'm talking about the life-threatening calls, the Echo and the Delta. And let's compare them from 2019 to 2022. For each region, in the East region, in 2019, the average response time for life-threatening call-outs was 15 minutes. In 2022, it was 22 minutes, an increase of 7 and a 47% increase. In the Midlands, in 2019, it was 19 minutes. In 2022, it was 29, an increase of 10 minutes or 53%. In the Midwest, in 2019, it was 16 minutes, increase to 25 minutes in 2022, an increase of 9, which is 56%. In the North East, it was 18 minutes in 2019, an increase of 26 in 2022, which is an increase of 8 minutes or 44%. In the North West, it was 18 minutes in 2019, increase of 2022, an increase of 4 minutes, and that's a 22% increase. In the South East, where I come from, in 2019, it was 21 minutes, and now it's the highest wait time of 33 minutes, despite the fact that we don't have emergency cardiac services operating on a 24/7 basis, as the Minister will know. That's an increase of 12 minutes, or 57%. In the southern region, the average wait time for life-threatening calls in 2019 was 18 minutes, up to 31 minutes in 2022, an increase of 13 minutes, or 72%. And in the West, it was 19 minutes in 2019 on average, went up to 26 minutes in 2022, an increase of 7, and that's a percentage increase of 37%. All figures produced by the Minister in response to a parliamentary question response. And then when you look at the percentage of calls which were responded to in the 19-minute time frame for both Echo and Delta, a decrease year on year from 2019. So how can the Minister say in his scripted speech today that response times are improving? Improving from when, exactly? Because the evidence is there in terms of the data which is presented to us from the National Ambulance Service and from the Dublin Fire Brigade. And in fact, the Dublin Fire Brigade told the Oireachtas Health Committee that in 2020, the offload or hospital turnaround time in Dublin for patients being offloaded from an ambulance into a hospital the average time was 29 minutes, with 6% of ambulances experiencing offload delays in excess of 60 minutes. In 2022, the average offload or hospital turnaround time in Dublin was 39 minutes. It went from 29 minutes to 39 minutes, with 16% of incidents having a turnaround time in excess of 60 minutes. So we're getting data from the HSE, data from the National Ambulance Service and from the Dublin Fire Brigade, all telling us the wait times are going in the wrong direction, and we have a Minister for Health who has his head in the sand and comes in, doesn't address any of the issues, doesn't give us any sense that there's any urgency, attacks Sinn Féin and attacks the opposition for tabling a motion which sets out the facts. And it strikes me that he's going to go off, as he always does, with his head in the sand and do absolutely nothing. And as Deputy O'Reilly said, he's not fooling anybody. He most certainly is not fooling patients who are waiting longer for ambulances, and he most certainly is not fooling those ambulance paramedics who we praised in our motion, rightly so, for the work that they do, and they're doing it on the back of huge pressures over time. Some of them in the Dublin Fire Brigade, by the way, that had to wait, and some still waiting for their pandemic bonus payment, another slap in the face that they were given by the same Minister for Health. So his speech today was absolutely appalling, and I would say shameful, and he should come back and correct the record of the Dáil for some of the inaccuracies and I would argue mistruths that was in his openings, in his statement today.
Thank you, Deputy Cullinan. I put the question that the government amendment in the name of the Minister for Health. The question is that the amendment be made. And it chartia tar hevan keshta avredish ta. And it chartia tar ganya avredish neil. Sheelam Gwilan Kesh Rachel. The division is deferred until the weekly division time tomorrow.